Hey, good afternoon, everyone. Thanks for tuning in. We have to excuse the doc. She had a family emergency today, so I'm filling in as the full-time host, the street practitioner. George, how you doing, everyone? Welcome. We're gonna start out with some of the events that we started that we participated in this weekend. We had two vaccination clinics going on for the Juneteenth celebrations. We had one in Darby, and we also had one in Chester at Subaru Park. We have some pictures to give you guys an idea what how the day went. Great turnout. Leslie, you could pull up the pics for us, and we could just discuss just how it went. That's what, of course, that's our buddy. That's Jen, Jada, the team. Great job. Great job. People really we're really touching the public. Like I did a lot of outreach work in the Darby area, and folks really showed up. Like all ages. It wasn't just boosters; it was people getting shots for the first time. Shout out to the team. The COVID reset team was in the building. There go my guy. What's going on? Francis, she was big help this weekend. After he was a success, total success. Kudos to everybody that came out. Kudos for Doc for just putting this thing together. Like it's just like a nice thing to do to give back. We just putting everything together and just keeping everybody just up on board. We don't want everybody to lose focus on what the main goal is. It's basically to get vaccinated and to stay safe. So kudos to Doc for streamlining this whole program and getting the ball rolling and getting our people acclimated mentally to really, just be stronger about what we need to do to take care of each other. So we actually do have a special guest today. We have Tyan. I'm gonna give you a little brief detail. We could bring Tyan in, and I'll let Tyan talk to you guys and briefly describe herself. Good afternoon. How you doing, Doc?
Hello. How are you?
All right, I'm fine. How you doing today?
Good. I'm here. I'm alive. I'm well. So great day.
Good. You're wearing the camera well over there. You're looking good over there. Okay. But no, Doc, tell everybody a little bit about yourself and a little brief description.
All right. Thank you. Well, I'm happy to be here. I've been behind the scenes for the past couple of weeks, so I'm a little shy to be in front of the camera. So, but I'm happy to kind of talk about this important issue. So I am Tyan Thomas. I am a pharmacist like Dr. Motley. We work together in the Philadelphia College of Pharmacy, which is now part of St. Joe's University. And as part of my being a faculty member, I teach students who are training to become pharmacists. And I also have them sit with me at my practice site, which is in Philadelphia. Can't say the name of it because I'm supposed to get permissions to say like who I'm affiliated with. And I've been doing that since 2006. So I've been an old vet at this. But a lot of what I do is talking with patients about, why they need to take a certain medication, get a certain vaccine, all predated COVID. And so, that's just a little bit of my experience. I guess that's just a little bit about me.
That's great. Sounds good. Not to go too far back, but like you said, you're already experienced in the area of pharmaceuticals. When COVID first hit, bring us up to date when the vaccinations hit the scene. So the vaccinations hit the scene. You already was in the pharmaceutical area. You were already in the mindset of, keeping people above, just keeping people on board as far as like getting vaccinated in other areas, shingles, flu shots, whatever. So now we got a new vaccination. So what was your take on it in the beginning?
Yeah. Honestly, just when COVID first hit, like just everything shut down, like our clinic went virtual and everything. And the first thing I was thinking is we just have to wait for this vaccine, just kind of hunker down. And I knew, I was going to get it when it came out. I was always a person that was about, an ounce of prevention is worth a pound of treatment. That's something my
Mhm.
mom always told me. And, and I had the ability to see kind of what would happen when people weren't vaccinated against shingles, for example, like you said, like the
Mhm.
painful rash or flu. And, with a lot of the patients I see who are older patients, the flu for them meant they would be in the hospital. And so I always got to see kind of that other end of the spectrum of people who weren't vaccinated and kind of what the consequences would be. So I already knew, like, I was not going to be one of those high risk people for COVID, like, hopefully I would not have been one of those, but I knew that I wanted to get vaccinated, so that I could kind of be back out, being able to work with patients and have a lower risk of my spreading it to them. So I kind of already knew I wanted to be one of the people to get it. I got the vaccine from the medical center where I'm affiliated with, I think
Mhm.
February of 2020. And really, I would have gotten it sooner, but I wanted to make sure that the frontline people who were still there, needed to get theirs first. And I waited my turn. And so, I got mine early, and I really didn't have any issues with it. So, that was my journey to getting vaccinated. And then I kind of knew that I was going to get my kids vaccinated when the time came, just because, again, I've seen kind of that other side of things when patients that I've been working with for years didn't get vaccinated against something. And then they unfortunately got that condition, and just seeing how it would like kind of ravaged and affect their like daily living. And I just knew I wanted to be able to, be vaccinated for COVID, so
Right.
yeah.
Wow. I mean, pretty much the typical role. I mean, for someone that's in the pharmaceutical area or medical field. I mean, you guys took a beating out there.
Yeah.
For 2 years almost. I mean, it was like frontline work. It was like you was in war. It was
Yeah.
like a medical war with anybody in the medical field. So kudos to you. Kudos to everybody on the front line, all our frontliners.
Yeah.
It was horrible. But I mean, it's
Absolutely.
funny you spoke about the kids. I mean, I kind of wanted to talk about that today. With summer being out, we only really got 2 months to get prepared back for school. We kind of was a hit or miss school season last year with certain things going on with the mask mandates. Certain school districts was fighting against the mandates, and certain parents were against the shot. So they were back virtual, they were in person. So by you being a mother, I mean, your take on it, I mean, the amount of children you have, and
Mhm.
pretty much like, what would your take on it as a mother? I mean, that's now you're making a decision for your children.
Yep. Yeah. So I have three kids. I have 8-year-old twins, and I have an 11-year-old. And
Hmm.
so, when things shut down with the pandemic, they were home for the rest of that school year of 2020. And I'm sorry, I just realized I misspoke when I said I got the vaccine. I got the vaccine 2021. So sorry
Oh,
about the dates.
okay.
But so anyway, so then they were all virtual for all of that following school year. So even though some of our, neighbors were letting their kids go back when schools were opening, it was just for us. I was fortunate that I was able to, do a lot of things working at home and being able to kind of help them with schoolwork. So I kept them virtual all for that whole following year into the school year that ended June 2021.
Wow.
But then also they didn't have the vaccine out for them either.
Right.
And so really what factored into my decision, I knew I wanted them to get it. I mean, having these kids in daycare since they were little, they always came home with something,
Oh
right?
yeah.
And so I knew,
Yeah.
I was like, once they're going to be back out in that world, it's just going to be a matter of time before they get exposed to COVID. And I just had to, realize that. And then what further increased that risk was when the mask mandates went away. So, I'm not there to be able to make sure they're wearing their mask all the time. The teachers, they have to do their jobs, and they're no longer, being told to make sure the mask mandates in effect. So I kind of knew that was going to mean even increased likelihood that they might, become infected with COVID. So I wanted to make sure that they got the vaccine. So that really is what factored in for me, was just knowing, you know, my kids are, social kids. They're going to be up in people's faces, playing sports, doing whatever, and, taking off the mask and everything. And
Hmm.
so
Hmm.
that was really for me just the the risk, was really low. I mean, the risk of getting COVID was higher, and then, the benefit of the vaccine, it just really tipped in the favor of wanting to get them vaccinated.
Right. So what basically you was pretty much already you already had your mind made up that once the vaccine came off for children, that they were definitely going to get it. I mean, it made sense because, I mean, I actually thought that kids was actually going to be the problem because there's no way they couldn't be disciplined like us. I mean, we were like 50% on the bubble anyway, and then we trying to trickle it down to children. So it was just like, once the kids go back and forth in school, it'll never end. It was like, and then who's going to chance that kids with the vaccination if they happily wanted to get it themselves?
Yeah.
So, I mean, that was like I'll give you a kudos to that for even just knowing that you already know that you had your mind made up. As far as that, I mean, kids already been getting vaccinations since they were born.
Yeah.
So, I mean, I kind of was on the fence with it, but I understand why. And in order to get the world back in order, we pretty much had to work it down to the children.
Yeah.
So I'm gonna just give you a couple more questions, just to pick your brain as far as the parenting decision, and we want to stay kind of on the kids because that's kind of in the news now. And like I said, it's summertime. They social. We're going to amusement parks. We're going to the beaches, family gatherings, and then we only got 2 months before school kicks in.
Yep.
So I have a question. We have: do you generally follow the vaccine recommendations for your kids? I can answer that, but go ahead.
Yeah, I was pretty good with trying to make sure we kept them on track with the vaccines, and I know that was just a decision for us, and I'm on the side where families have to do what's right for them, right? So I have a friend who I went to college with who's a nurse practitioner, and she kind of did a longer term kind of spaced out vaccination cycle for her son. And I mean, that was what was right for her. But like for me, I usually follow the recommendations. But so that made that easier when it was time to kind of come up with a decision for the COVID vaccine.
Right, I could have answered that for you. That was easy because I mean measles and certain whatever. I don't know if they still do chicken pox. I mean, in my era they did, but it's just like, okay. I mean, it's pretty much mandatory to go to school, to go to daycare. They have to be vaccinated so they don't spread it. So it's pretty much.
Speaking of that, I was one of the people that did not have chicken pox vaccination when I was out, and I got it twice. So I was like, if I could keep that, that's the other thing too. My sanity of not having to be home with a sick child with fill in the blank, like that's my side of things too, is that this is helping me also, so
right. Yeah. I mean, exactly. I mean, it will put more pressure on you as a parent if your kids get sick or you're sick. So I mean, it makes sense. And even with you being in the medical field, you still had to wait for your personal decision for your household. It's not the same. Everybody thinks because it's doctors and nurses. No, you had to do the same process as a parent. But you also had to be defensive against this thing because it took over the world. So I already knew that answer. So we're not going to stay there too long. All right, this was an easy one too. I want to know what did you what was like your main factor with oppositions against the vaccination? Because it seemed like you already was sold on it. But what was like your other factors, like on the negative side? Like, well, it might have been 10%, 15%, but what was your other alternatives like against the COVID or against the vaccination?
Yeah, I think it was just knowing that, you're not going to see all of the adverse effects in the clinical trials because you can only have a finite, number of people. You can't have everyone, in the studies. And so we did take the delayed approach. We waited we waited a couple of months after the kids' vaccinations were out to actually get them vaccinated. So, and just taking it all in, listening to the, family who got their kids vaccinated and they did fine, just kind of really made us feel better about that. But that's always the one thing that I think about too, just wearing the pharmacist hat, is that you never really know like all of like the adverse effects until it's out there for everybody, right? And
Right.
so that was the one thing that was kind of like, okay, we're gonna wait a little bit, but we know we're gonna get it. It's just a matter of when, not if.
Right. Right.
Yeah.
And what I also noticed, like to be more personal, is that it actually depended on your community. Like it depended on your community, how your community approached the vaccination, as opposed to the school and how they had to combat, cases, or even just the fact of being vaccinated or wearing a mask. Like I said, certain areas were like more opposed, certain areas, was against. Like it depends. If you have a domination of parents who really was against the vaccination, then they were sending kids to school under the same conditions. So it was like that's a major factor. And that's kind of why I understand Doc's movement, because you guys been behind the scene and you are of color. Like us, like we need that personal effect and our own folks to be kind of guiding us more, so we don't feel like it's like a bamboozle type of situation. So it's just, I get that part of it, but it's just funny how certain communities was already standing in line waiting for the scientists to finish.
Yep.
You know what
Yeah.
I mean? And then it's like some of us was just like, nah, no, it's been 3 years. I don't know. But it's like, but everybody in that family was sick. And I think the worst thing is for you won't want your child to get COVID. Like
Absolutely.
that's the worst thing ever. I mean, you don't know what kind of effects. The immune system is not always built to a certain capacity, and you just don't know. And you kind of want them to be on the mend. But I just, like I said, it just depends on the community, and that's kind of what this movement is about.
That's true. And the other thing too, that we have to remember is that, a lot of people in our community, we are living like grandparents with the grandkids. And that's the one thing that I was always worried about as well, is our kids mistakenly passing it on, to like a elder or whatever the case is. And just to be clear, I know vaccination doesn't mean you don't get COVID, but it's one of those things too, that if they should get it, they won't have it as long, infectious for a smaller period of time. But that's the other thing too, why I think it's really important for the kids to get it as well, because, we're in a community setting where we're taking care of each other and we're taking turns taking care of our kids. And so we need to make sure that we're kind of having that protection around us, so that our community is not spreading it, to each other, even if it's not intentional. So, I just really, feel strongly. And whenever I would talk with my patients, they would say, do you think I should get it? I'm like, yes, you should get it. You know what I mean? And so I was just always a big advocate. And it just, again, I just really want to point out too, is that, I've seen the other side of it, where I had a patient who died from it like in November 2020. And I was just, it was just so frustrating, because I had been working with him for years for one of his medical conditions. And it's just that whole, this could have been, prevented or whatever the case is. But he got it before the vaccine came out. So it just made me feel that much more strongly about saying, when I can get it, I want to make sure I can get it. Because we as the health professionals, we kind of see the effects and hear the stories, and you see the patients who are on the ventilators, young patients, and I saw a little bit of that too. And it just hits you differently when you kind of see like what can be the worst effects of not being vaccinated, and then also seeing people who have been vaccinated, and then you're giving out all these vaccines, you're not hearing about really bad adverse outcomes quite so much, but you're seeing like the effect of that person that's in the hospital ventilated for weeks. It just kind of changes your perspective a little bit,
Yeah, I mean, I can dig it. That's what I'm saying. Like, you was behind the scenes. So behind the scenes is totally different from my version, or even from the news, the way it's reported. It's different when you're hands-on with patients and you know what this disease really can do. I mean, you watch it destroy or kill people. It was basically designed to kill our immune system.
Yep.
So, I mean, there's no way we could take that lightly. I mean, kudos to the scientists that worked on it and basically saved mankind. That's how I'm looking at it. I mean, we was already at, like, I ain't gonna say the brink of destruction, but we was kind of close when all the stores was closed, except for the supermarkets, and certain things was missing off the shelves. I mean, it was something that we never really experienced. So, I mean, if it wasn't for the vaccination, we wouldn't be even talking, we wouldn't probably even have this segment right now. We probably would be, who knows, the radio station might have shut down. I mean, you just never know how detrimental, how serious it would have got if the vaccination wasn't, created when it was. So it was just like, I feel like it's our duty. I feel like, as a parent, you definitely have to be mindful of, your child's situation. Some kids, they have asthma. Plus, it's like a lot of things that kids bring home, like you said, from school. If they're going to get sick, no matter how much you protect your child at home, washing their hands, and a lot of kids not taught to do that. So they're coming to school with germs already. On top of it, now we have a new disease for them to be able to have to worry about. So, I mean, wow, it was just a big 2-3 years. I'm really not going to touch on the 5 and under because it's kind of still fresh, but I do want your insight on it, like, because I mean, that's a way younger age, meaning like they're still developing. Their teeth not even all the way in. Like, it's certain things that I'm just like really would be scared about as a parent, even though it got approved.
Yeah.
I just want your little brief take on it before we go into, until it really comes out. But I just wanted your take on it. I mean, your kids are older. So
yeah.
What if they were younger? What if they were 2 years old, like little Noah? So
I'm thinking I would, if it were me, I would say I would wait just a little bit just to kind of see the rollout and see kind of what kind of the reports come out of just, the adverse effects that might not have been picked up in the studies. But it really would make the kind of the decision, sway on giving the vaccine or not is if they're in daycare. I mean, daycare is like that one thing where, it's just, so if I knew they needed to go to daycare or whatever the case is, that would make me want to get it sooner than later. The other thing too is, spacing out the vaccine. So if there is a concern about, okay, so now they're already scheduled to get flu and all the other things that are already on the schedule. And you're like, do I really want, him or her to get another vaccine? You can space it out. I mean, the pediatricians are really good with doing that. But then it also comes with, if you're working, like, are you going to be able to get another day off to, get that? So, I mean, there are ways, if there are some concerns about even just the pain of the injections and things like that, there's ways that you can kind of like, space them out. And that's something I would say, talk to the pediatrician about if that is the concern. But daycare is that one thing where I would say, if you're going to have, your kid and with other kids, I would just go ahead and get it, because it would just be a matter of when versus if they get it, and unfortunately, like even with like, masking with the workers and everything, you just don't know. Like it's everywhere now, pretty much all the different variants of COVID and things like that. And so that to me, the daycare situation would like really tip me into like being on the side of getting it.
Yeah. So. I think that will push me over too. I mean, because I already felt like wary and leery about the daycare. Like, like you said, we don't know how other children are being taught, and kids are germy. Like, they pick up stuff off the floor. I mean, especially at the age of 2 and the younger ages. I mean, we might not catch it all the time. Yep. And if they're being brought to daycare, and then if their family's not vaccinated, not vaccinated, who knows? So then they will bring it home to you, and it'll just be a chain effect. So I totally get that.
Yeah. And how do kids at that age learn? They touch. Everything is touching, right? I mean, that's how they learn the world. And I mean, you're not going to have them have gloves all the time, even if you're spraying doorknobs as often as you can. I mean, it's just you can't keep up with it, So
right. So I think I got one more good question, and it's now that the COVID vaccine is available for the youngest kids. Well, we basically touched on it. I kind of skipped that. Yeah, I kind of skipped on. We kind of worked off. We already went to that question as far as like what would lead you into protecting your baby, and we basically both feel the same way as far as the daycare and just the germiness of the children. But as far as your advice, now it's been around for a while. COVID-19, we're going on 23 already. So
Yeah,
we got 6 more
hard to
months.
believe.
We talk. So, what would be your advice to someone that's not vaccinated, and a parent as well, getting prepared for the new school year? What would you say? Not without putting them in handcuffs, but just your mentality and just being behind the scenes, and just your knowledge of the disease and the vaccination.
Yeah. So my take is, thinking ahead to the school year, our plan is to get them the second booster closer to when the school year starts. So, and what seems to be happening is that the manufacturers are incorporating the newer kind of variants into like the newer versions of like the boosters and everything. So my prediction is, and I'll deny that I made this prediction if I'm wrong, but I have a feeling this is going to be like the flu vaccine, where like every year you just come in because there's a new dominant strain. And so we just have to kind of get our heads thinking in that way. But I will say we already didn't get our flu shot, so I don't know if that's a good thing that we're thinking about it like the flu shot or not. But so if your child has already had their 2 shots, and then I would say think about getting that third shot right before school starts, and give it a few weeks before school starts so the immunity is already there once they're kind of in school. If they haven't already gotten it, I would say just really think about, having them at least get the first series, vaccinated and everything. I've already said why. It's just that it's just a matter of kind of when, what else was I going to say? I just think we really should think about getting it. And I guess the other thing I would say too, and you made a good point, George, is that like we're thinking about the community, right? And so you have to know your community to know like how are the parents feeling about masks and everything. So I will say we were like a 50-50 community. So I already knew. I was like, okay, only half the kids are going to wear masks, which means, I mean, that's nothing. Like if you don't have at least 90% of people wearing masks, the mask thing is not going to work to kind of keep the infection rate down. So like really think about your community. And I would say the world, I mean, we like it or not, the world's getting back to normal. They're already saying, hey, we want to be, but they wanted to be back out here even before the vaccine was out. So, you can only fight it for so long where you're going to get pulled back out into the world eventually, and it's just all those things too with, you can keep wearing the mask, but then just eventually you're going to be someplace where you might mistakenly let your guard down. Like the more and more you're seeing people not wearing masks, it's just harder to like remember to wear it. So just that's to me more reason to say you really should think about getting it, because the world is kind of saying we're going to be back pre-COVID, even though we're in the world of COVID. So, just go ahead and take that extra step to protect yourself, because we're no longer in this place where we're protecting each other by wearing masks. So you kind of have to put it back on yourself to do this thing to help protect yourself and your family. And that vaccination is that thing to kind of give you an additional layer of protection. So
great answer. Great answer. I mean, it's basically like you said, it's not even a hit or miss. It's pretty much our duty. It's like what we pretty much owe the community, owe ourselves. There's always information on the vaccination. There's always people that you can talk to. Everybody has some type of hesitancy in the beginning. So, I mean, and even more for your children, but it's the best thing to do. So again, that was a great answer. I'm actually want to talk to Doc about doing like a kids vaccination towards school. Like after, we get like, I'm thinking like in August, back to school like time mentality wise around that area. So I would love for you to come out and assist with us if you can. Bring the kids.
Sure, I love to. I can give vaccines.
Vaccination, we got it, guys.
Yeah, I'd love to do it. Yep. I can't give vaccines. I'm licensed in Maryland, so I can give them. I just can't legally give it in Pennsylvania, but I can do moral support. But And I
Right.
just wanted to say thank you guys too, because I mean, a lot of times we have to go to where people are, and that's what you guys are doing. And you're out there just listening to people and listening to their concerns. And like you guys have been saying with all of the other shows, you know, it's not just saying, oh, like, you know, you're crazy to not get vaccinated and try to make people feel bad about it. It's just about hearing them say, what are your reservations, and just talking through it. And, you know what I mean? You guys have changed so many minds, and it's just because you've been doing the work and you've been just listening, giving information, listening, receiving information from them. And I think this has a far more, you know, long-term impact with just talking to people and letting them come to the decision themselves instead of like coercing them into it. And so I just really thank you guys for doing the work in this area.
Oh yeah, I appreciate that. I mean, I really do. And like you said, we could just be the face. We'd like to host one in Chester, like before school kicks in, and probably in Derby again, Yate and Collindale. I have to talk to the doc, but I think this is like pretty much our duty, and I don't want us to be scared of it. You know, we should be more scared of not having it than you know, than having it. So, but again, thank you for a great fill-in guest. You always welcome. You be behind the scenes anyway, so glad we got you from behind the scenes and got you in front of the camera. Your perspective was great. Keep up the great work, Doc. Appreciate you. And I guess that's it, Doc. Let's get back on next week.
Yep. Thank you. Yeah, I'll see you next week behind the scenes, guys.
All right, thank you again.
There. All right now.
All right. Okay.